They say alcohol is good for the heart. So since I've had a heart attack, am I allowed to drink? This is a question that some patients ask us in the clinic. Some people looking for approval say, "Doctor, I drink pure Shiraz wine. When I drink, my soul feels rejuvenated. I feel great. Do you approve?" If I want to give a short answer, it's no. Hello, I'm Dr. Habibi. I'm a cardiologist. In this video, I want to talk with you about the cardiovascular effects of consuming alcoholic beverages and red wine. So stay with me. The recommendations and treatments we doctors provide are not based on personal or individual preferences. They're not based on religion or faith either, nor are they influenced by pressure from the Islamic Republic. Our recommendations are based on the latest guidelines and protocols from American and European organizations and the World Health Organization. And what I'm sharing with you is exactly based on that. The truth is, until just a few years ago, all global recommendations and guidelines were like this. Excessive alcohol consumption is harmful to the body and can lead to heart damage, but moderate consumption could have beneficial effects. But in recent years, a lot of research has been conducted and large studies have been carried out in European countries and the United States. And they found that even low levels of alcohol consumption are harmful to the body and lead to increased heart damage. For this reason, the latest European and American guidelines, as well as the World Health Organization, all unanimously agree that alcohol consumption is harmful to the body. Now, what was the origin of this issue? The origin goes back to the French. The French are known for their excessive consumption of red wine, but it was observed that despite this high consumption, their rates of heart attacks and cardiovascular diseases are low, and it was suggested that perhaps it's the red wine that has a protective effect. But later, when more research was done, they found out that this wasn't the reason. The reason is that they have a healthier lifestyle and because they don't have other risk factors for heart attacks. For example, they have lower blood sugar, lower blood lipids, less exposure to smoke, cigarettes, and other risk factors, and that's why they have fewer heart attacks, not because of drinking red wine. To be fair, I'll start by talking about the beneficial effects of alcoholic beverages. Ethanol or alcohol varies between different products. For example, in whiskey and vodka, the alcohol content is about 40%, while in red wine, it's 12 to 15%. In beer, the amount is lower. It's between 3 to 5%, and in distilled alcohol, which is called arak, the percentage is much higher and can reach 50 or even up to 90%. And the higher the alcohol content and the greater the consumption, the stronger the effects will be. All right, let's first look at the beneficial effects of alcoholic beverages, alcoholic drinks, and ethanol. It has 4 beneficial effects. First, it increases HDL cholesterol. You know, we have 2 types of fat in our blood. Good fat and bad fat. The good fat is called HDL. It's like those recycling trucks that circulate in the body and bloodstream. And it collects the excess fats that have built up in the arteries, the oxidized fats and waste materials, and brings them to the liver to be processed and eliminated. And consuming ethanol and alcoholic beverages increases the HDL level in the blood by 5 to 10%. 2. Antiplatelet effects. Platelets are a factor in the blood, and their activation leads to the formation of clots and blockages, which can ultimately result in a heart attack. Consuming alcoholic beverages inhibits these platelets. 3. Improved insulin sensitivity. This means that in people who have diabetes and high blood sugar, it improves their function. The 4th effect is specific only to red wine and is not found in other alcoholic beverages. And that's because it contains certain substances called polyphenols. Polyphenols have antioxidant and anti-inflammatory effects, which is why they lead to improved function of the cells lining the blood vessels. But the point is, despite these beneficial effects observed in research and clinical trials, they ultimately do not lead to a reduction in mortality or a decreased risk of heart attacks. All right, now let's move on to the side effects and harms of alcoholic beverages. 1. Raising blood pressure. Consuming alcoholic beverages increases blood pressure. 2. Cardiomyopathy and heart failure. People who consume a lot of alcohol gradually develop an enlarged heart and the heart muscle becomes weak. 3. Increased harmful blood fats, namely triglycerides, and consequently increased abdominal obesity. 4. Increased risk of esophageal cancer and breast cancer. And 5. Causing cardiac arrhythmias, which are especially seen in people who consume a large amount of alcoholic beverages in a short period of time. There is a syndrome called cardiac syndrome. On holidays, foreigners usually work from the beginning of the week to the end, and that's why during those 2 days off, they usually go out, have fun, and many of them go out. They consume very large amounts of alcoholic beverages within just a few hours, and this causes their heart rhythm to become extremely irregular, which we call arrhythmia. This arrhythmia carries risks such as cardiovascular arrest, and it can even lead to strokes. When we weigh the beneficial effects of alcoholic beverages against their harmful effects, the side with the harmful effects is much heavier. Overall, for people who consume alcoholic beverages, we see more negative effects. That's why the risk of heart attacks, the risk of cardiac arrhythmias, and the complications we mentioned are significantly higher in people who use alcoholic beverages compared to others. Another point to mention is that these negative effects occur even when the alcoholic beverages contain only ethanol. But sometimes in cases where alcohol is produced, homemade. For example, in Iran, where alcoholic beverages are illegal, it is usually produced at home or in workshops where there is no supervision. And during this process, methanol, which is a dangerous toxic substance, may also be produced. And this methanol has two major side effects. First, it can cause permanent blindness, and second, it can lead to death, causing the person to lose their life. And you've certainly heard that in recent years in cities like Shiraz and Avaz, many people have lost their eyesight or even died because of consuming these counterfeit alcoholic drinks that contain methanol. So what is the final recommendation? The final recommendation, according to the latest guidelines from the American Heart Association, the European Society of Cardiology, and also the World Health Organization, is this: if you don't drink alcohol or alcoholic beverages, don't start. If you do drink, you should definitely quit. But if you don't have enough willpower to quit, or if you're already used to it, at least keep your consumption to a minimum. Now, what is this minimum amount? For men, a maximum of 2 drinks per day, and for women, 1 drink. Why? Because women's bodies are more sensitive. So what exactly is a drink? Each drink is equivalent to 14 grams of pure ethanol alcohol, which varies depending on the product and the type of beverage the person is consuming. For example, with whiskey and vodka, since they're about 50% alcohol, it's said that half a small glass is the equivalent. And for something like red wine, it's about 1 glass. And for beer, it's about 1 small can. So our final recommendation is to avoid alcoholic beverages altogether. And if you are consuming them, quit. Thank you.